Hi everybody. Caregivers that I have been speaking with recently are telling me that they are struggling to care for elderly parents in a variety of areas. Some of these include how to help elderly parents stay at home, how to manage health problem after health problem, how to navigate care with doctors, insurance companies, and healthcare systems, and how to identify and work with services that you may not know are available, especially if money to pay for care is a worry. What I can tell you is that research confirms that there is a link between caregiver confidence, education, knowledge, and health. Now, this doesn't mean that if you don't have an advanced education or a college education, you are not or you cannot be a good caregiver. What this means is that you just may lack access to the information and knowledge that you need and people who can help you, which is why I create all of these videos here on my YouTube channel to help you get further and faster. So please click below, like this video, follow my channel. It will help more people find these videos. And please comment, even if it's only to say, hey, thanks for the video. So on the topic of education and learning more and getting further faster in caring for elderly parents, maybe you're caring for yourself, grandparents, spouse. What I suggest is a couple of things. That family caregivers join either an in-person or an online support group. I have one on Facebook. It's called the Caregiving Trap. You can search for it and request to join. Or take some kind of online caregiver education program. I have 3 of them on my website. There's also a lot of education on disease-specific websites like the American Cancer Society, the Alzheimer's Association, the Heart Association, and many, many others. Now what happens is when I suggest this, you're probably all saying, Pamela, I'm too busy. I don't have time. I can't do it. Life's just too hectic. Well, here's the thing that most people don't realize. Years ago, I had a care management company. I've been doing this for almost 25 years. And I would train my care managers to say, look, you've got to plan your time. What are you doing tomorrow? How much time is it going to take you? What are you doing the rest of the week? And they would always say, oh, Pamela, I don't have time to do that. I can't take time to do this. I have so much to do. So what they didn't realize was if you don't plan your time, you don't get anything accomplished, right? You feel like you're running from here to there and the day's gone and you don't know what you got done and you have all this other stuff to do. Are you a caregiver who feels like that? So in this video, I will share reasons that people feel that they don't have time to learn and to gain skills to make their life easier. This activity can make a major difference for caregivers who want to help loved ones get better care and to manage the caregiver's time. So all I'm asking here is that stay with me for this video, be open-minded, say, I can't do that, I don't have enough time, blah, 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 right? It's important to transition your mind from an I can't and I don't type of thinking to yes, I can. Yes, I will. So stay with me. If this is your first time here or whether you are a returning video watcher, I appreciate you all. I'm Pamela D. Wilson. I'm a caregiving expert, advocate, consultant, and speaker. You can visit my website, PamelaDWilson.com, where you can find a way to schedule a one-on-one consultation with me, along with my 3 online educational programs for caregivers. I will place links below this video on my YouTube channel. So after you watch this entire video, you can click below to find that information. To understand how positive the impact of knowledge and education can be in one's ability to get better care, to stay at home, to be healthy, to navigate the healthcare system. Let's first look at why people don't pursue or follow through with this. Let's learn about all of the problems and the challenges and sometimes just the excuses of, I don't have enough time. I can't do that. Yes, you can. So the first one is always a barrier for a lot of people. It's cost, right? It's money. If you look at any type of more formal education like, a technical college or school, right? Any type of education can have a financial cost. This video here, it's free for anybody to watch. The 3 education programs on my website, same, free, no cost. The only cost is your time. So for caregivers seeking education on how to care for elderly parents, grandparents, family members, for people who want to be healthier and manage their health care, cost for the education on my website, it is a non-issue. You have no excuse, right? Number 2, second reason caregivers don't seek knowledge and education that can make it easier to manage care is a practical one, right? Trying to balance work and family life and everything else that you have going on. I get that. But if caregiving is consuming more and more and more of your time and your emotions and you're stressed and you're having to trade time with your family and your kids and you're worried about your job and all this is going into this caregiving thing, it's important to know that rebalancing this is a matter of simply learning to set boundaries, managing time, and learning problem-solving skills. If you haven't mastered these 3 skills, you're more likely to be overwhelmed, feel frustrated, be an exhausted caregiver, be worn out, regretting everything that you're doing, and complaining because no one else is helping you. Again, this video, the other videos here on my YouTube channel, the information, the free education on my website can teach you how to set boundaries, how to say no, how to manage time, how to problem solve. Then the other reason that caregivers don't seek knowledge is you're too distracted. You're over here and you're over here and you're over here and you're over here and your mind is like chasing the last shiny thing. It's poor concentration. It's also inconsistent habits. So gaining a new habit can take at least, according to research, 30 days to do it, right? You have to do it every day for 30 days, and then it kind of becomes like, well, it's just something that I do every day. One of my habits is exercise. I exercise every day. Early on when I first started, it was probably a little struggle to do it, but now if I don't exercise, I miss it because it makes me feel good. It clears my mind. A lot of health benefits. All I can say about poor concentration and inconsistent habits is that if you don't plan things in your life, you're never going to get there. If you don't, or you can't, or you're unwilling to make the time to improve whatever it is, whatever skill, whether it's a caregiving skill, skill at work, relationship skills, social skills, whatever. If you don't or you can't make the time, there's going to be a time, if it's important to you, right, that you're going to be so overwhelmed that you will be willing to do just about anything to solve this problem because it's gotten bigger and bigger and bigger and bigger. And you're going to want to get out of all this, oh my gosh, emotional distress, the fear that you're experiencing, the burnout, thinking that, oh my God, I cannot possibly go on with this any longer. Why put yourself through that when you can gain some skills and education up front? There's no need for that. So before you get to that stage of total burnout, let's look at how spending time to gain confidence and knowledge can fast forward your caregiving skills. And a lot of these skills apply to other areas in life. Again, you can join my caregiver support group on Facebook. It's called the Caregiving Trap. Take one of my 3 online courses. So number 1, when we push ourselves to learn something new or to try a new experience, maybe you want to go to a movie and nobody wants to go with you, so you're going to go by yourself, right? When we push ourselves to do these things that are uncomfortable, we can be afraid. We can think, oh my gosh, what are people going to think about me if I go to the movies by myself? Nothing. They're there to watch a movie, okay? All of these emotions and feelings come up, right? Because we're moving out of this comfort zone. Now, this is very interesting. In caregiving, as in other situations, every situation has a comfort zone. But in caregiving, this comfort zone may be You're used to feeling unappreciated by the person that you care for. Or you may be constantly criticized by your mom or your dad or your siblings or whatever, and they're making you feel that you're not good enough, and you're getting comfortable feeling not good enough. Or maybe you've given up your life and you live with your aging parents and they are financially supporting you, and you've done this for a period of time and you're thinking, I need to get my life back. I need to look for a job, but you don't know how to look for a job. Looking for a job today is not like looking for a job a year ago or 2 years ago or 10 years ago when you actually had to show up somewhere for a job interview. Everything today is over the internet. It is a new world. So think about this. Isn't it amazing how we get used to these comfort zones, these negative comfort zones, and we find it difficult to put ourselves in an uncomfortable situation that can move us forward, right? We're already in an uncomfortable situation. We would rather be miserable and stay miserable, like that frog in a boiling pot of water who can't jump out, right, and dies. We'd rather be miserable than change, take the effort to change, make the effort to change our mindset to change. That could get us to a much better experience because we are scared to death. So find time to learn something new. Easy way. There's over 800 videos here on my YouTube channel. Watch a few. Search for the videos that say boundaries, problem solving, planning. Go to my website, PamelaDWilson.com. So much information there. My 3 courses, plus blogs, links to all my podcasts, The Caring Generation. Invest some time in you to learn, to become more knowledgeable, to make your life easier, to make your caregiving life easier. What have you got to lose? Absolutely nothing. Number 2, when you think about it, caregiver support groups online, in person, they give you access to the experiences of a lot of other people that you may not currently have in your life. And they give you access to expertise. So I have been doing this for almost 25 years now. I have helped caregivers and older adults in as many situations as you can imagine. Great situations and not so great situations. I've worked in aging, elder care, and caregiving. So how does accessing new information, other people, and experts help you, right? Well, you can gain a better understanding of basic health information that you may not be aware of, and available services that you may not be aware of, so that you can help yourself and the person you're caring for make better care decisions faster, easier, and more effectively. You won't have to second guess yourself. Am I doing the right thing? Is this going to work out? I don't know, right? We all feel like that. The second one is caregivers who have more knowledge, more education, and who are more confident. You're in a better position to help the person you're caring for get the care they need because you're like, hey, I got this. I know how to do it. I've done this before. I'm working through it. And so what happens is having all this knowledge and education means that the child-parent relationship where previously you were the child who depended on your parent for everything, money, a place to live, okay, that switches back. And now your knowledge, your education, your experience can benefit your parents. It can help you get a better understanding of health in general, of health prevention, better health habits, how to manage your health and your parents' health, how to work through the healthcare system, how to do all this. And think about this. When you learn all this stuff, you can pass it along to your children. Because I know a lot of caregivers who say, oh, I don't want to be a burden to my children. Well, if you don't learn, if you don't plan, if you don't pass your education along to them, you're probably going to be in the same situation you are right now caring for your elderly parents if that is a big mess. So I want to talk about 3 other habits that negatively impact health. And I know a lot of you who hear this are not going to like it because you've probably heard it before and you're like, I'm tired of people telling me to do this. Well, smoking, an unhealthy diet, and a lack of daily exercise. I know, nag, right? But I'll tell you, these 3 habits are more likely to result in health problems in your middle age that become worse when you get older and you're retired and you want to travel and do things and you can't, and your retirement is totally like taken off track. It happens to more people than you think. And if you're caring for your elderly parents, you may be witnessing the side effects of one or all of these habits. Your parent can't walk, they have poor balance, they're tired, they're weak all the time, they have gastrointestinal issues, they have lung issues, all these health diagnoses, right? It just happens. It just happens. So, on the other hand, the good stuff, the good side is if you learn about the risks of a lack of education and a lack of knowledge about health and smoking and eating junk food and becoming physically weak and out of shape and overweight and tired, you can do something about it. You can change these habits that will have an amazing and positive impact on your health. You can do it. You have to start a habit to work on it a little bit every day, and then it gets easier. Now, the problem in all of this is if we find ourselves in a position where we don't know what to do or we're trying to figure something out. The problem is that unless we gain this knowledge or access to people who know more than we do, or experts, or get into groups of people that can lift us up, right? We don't have access to this information or this knowledge. We don't know specific to health, right? To embrace positive health habits, because nobody teaches us that in school. It doesn't certainly come through friends or other places unless you hang out with healthy people who exercise and don't smoke and maybe don't drink and eat healthy and all that kind of stuff, right? So what happens is most people lacking the education and the knowledge continue all these unhealthy habits till one day you're 30 or you're 40 or you're 50 and you don't feel good and you're sick and you got all these health problems, right? So there is a benefit, no matter your age, 15, 20, 30, maybe you're a young caregiver, 60, 70, 80. You can change at any age. Change has like no limitations on what age you are. If you're 99, you can change, right? There's a benefit to gaining early knowledge, education, confidence about health and caregiving and everything that goes with it. They can help you be more proactive with health and all areas of your life. And last but not least, it is so important for caregivers, especially caregivers, who think that you have to do this all by yourself. Get comfortable with asking for help and seeking information and making a plan so that you can change your situation if you're not happy with it. More knowledge, access to people who can inspire you and motivate you and help you with the practicalities of everyday life can help you get further and faster when you're caring for an elderly parent. So go below, click on the links, go over to my website, PamelaDWilson.com, in-depth program called Support Caring for Aging Parents. I also have a podcast called Caring Generation. Those podcasts are here on my YouTube channel. You can also listen to them on Apple or Spotify or a number of other podcast apps worldwide. There are, again, the videos here on my YouTube channel that ask questions caregivers ask. So if you have a question, put it below. I will create a video and answer it. As you gain knowledge and education and confidence, you're going to notice that managing care for elderly parents becomes so much easier. Others are going to respond to you in a more positive and helpful manner because you have learned the skills to help other people want to help you, because you have learned the skills to ask the right questions, the important questions. You can more easily manage all of this emotional craziness and madness and get the drama out of your life that, maybe before something would happen and you would just like snap and go off the rails, right? And that resulted in like blow-ups and disagreements with other people, and it made people not want to help you. A mess, right? Hot mess. And even more importantly, instead of saying, oh yes, I'll take on more caregiving work, I'll continue to do it all, you will begin to set boundaries and say, no, I can't help. However, there's information over here that can help you. Here's a suggestion about what you can do. Maybe we need a different plan. Through the information on my YouTube channel, my podcast, my website, my courses, You will gain the confidence to stand up for yourself, to advocate, to not be afraid to ask doctors and other healthcare professionals questions, and to recognize the importance of you being the person to follow up with test recommendations and lab work and other aspects of care that honestly get lost in the healthcare system. I mean, you could have an important test result and it gets lost at your doctor's office and nobody calls you and they don't tell you that this is a problem. You could have followed up, but you thought, they'll call me when it's available. 6 months later, you have a train wreck for a health problem because you didn't make that phone call. You can't blame them. You could have called. You could have followed up. Be proactive. So making the time to plan and schedule all these activities can and will make you more effective and efficient in other areas of your life. As I previously mentioned before, my employees who were like, oh, Pamela, I don't have time to plan. I can't do this. I can't do this. Well, what they learned from planning and scheduling was that they often overestimated their ability to complete a task within a certain amount of time. So how many of you as caregivers think, well, I'm going to go over mom and dad's and I'll be there for 2 hours, and 8 hours later you're still there because this cropped up and this cropped up and you didn't think this would take so long. The grocery store would only take an hour and it took 3, right? So my care managers, because they didn't plan, felt like they were continually running behind and that they were bad people and they couldn't get stuff done. How many caregivers feel this way? A lot. Planning and scheduling your time can help you gain a more realistic estimate of what you can do in a limited amount of time. Okay? This is why caregivers quickly become overwhelmed, because you have no idea how long something takes you and it takes you 10 times longer than you thought. So if you plan and learn, you will actually accomplish what you schedule in the time you planned. And you won't feel like you're drowning in caregiving projects. A side bonus is this will translate to other areas of your life, and you'll feel like, wow, your self-esteem is going to go up. It's like, I can do this, I can manage this, I can do all this, right? The key is don't take on more than you can handle. There are so many benefits for your entire life to making the time to gain knowledge and education and confidence about how to care for elderly parents or your grandparent and yourself. This is not something that we are born knowing, right? It's something that most people learn through the school of hard knocks or trial and error by making mistake after mistake after mistake. But it's really unnecessary to go through all that when the information is right here, okay? The only cost is your time. So I thank you all so much for being here. I am Pamela D. Wilson, a caregiving expert, advocate, consultant, and speaker. Again, please like below, please follow my channel, please comment, even if it's only to say thank you so other people can find their way here. I will see you all again soon in another video.